today, the global COVID-19 pandemic cases stand in excess of 2.5 million, with approximately 600,000 recoveries and 170,000 deaths. Here at home, the numbers have been rising every day. Even in these times, we still have cynical Kenyans who hold the view that this disease is not real. This is very disturbing, particularly in light of the growing numbers of people who are infected. As we continue this fight, we note that there are some of us who continue to disobey the measures and regulations announced by the government. I would like to remind you that we are in a war situation against an enemy that is not a respecter of age, status, gender, race, and religion. Some of our young people are deliberately breaking curfew regulations due to the false belief that they cannot catch this disease. And we would like to remind you young people, including myself, that we are actually able and susceptible to get this disease. In the early days, we cautioned you on surfaces that are likely to be contaminated in the aid of the transmission of this virus. Among such surfaces include groceries in supermarkets. We would like to acknowledge efforts made by many outlet stores by providing sanitizers to shoppers and ensuring that no shopper is allowed into a shop without wearing a face mask. However, we are concerned that it is important that cashiers handle the goods correctly, especially during payment at the counters. These are also areas that can be easily contaminated and that can lead to infections. And therefore, we are urging all supermarkets to devise innovative ways to address this issue. The same should also apply to banks, particularly in the aspect of different people sharing pens in the banking halls. Fellow Kenyans, this is a long journey that we cannot walk alone, and I want to thank all the individuals and corporates who have so far contributed to this containment effort. I particularly want to thank the Kenya Air Force for deploying 2 aircrafts that have been flying banners, aiding in our communication with banners stating that we should stay at home. I'd also like to thank our healthcare workers for their continued efforts, and particularly today, where the Kenya Editors Guild Association, together with the Kenya Medical Association and the Association of Nurses, has initiated a campaign dubbed Saa Sita. In this campaign, at midday every Wednesday, we will all stop and clap for all our healthcare workers. And this is a campaign that is being rolled out in different countries across the world. This is to appreciate the role of healthcare workers and the crucial role that they are playing in this time of COVID-19. Let me also acknowledge the contribution of mobile network providers, and in particular, our national carrier Safaricom. Through its foundation and other donations that have come so far, they've contributed close to 10 million Kenya shillings for thermal scanners, and they've also helped us in expanding our screening capability. Additionally, Safaricom will be supporting healthcare workers and is in the process of rolling out a free communication package. This package will include 3 months of internet bundles and airtime for our healthcare workers and will form part of the comprehensive care package for our healthcare workers. Yesterday, we mentioned to you that the strategy that has been formulated and agreed upon globally as the most effective way of fighting this disease rests on 4 pillars. That is, testing, isolating, treating, and tracing. We have ramped up our capacity in all these 4 pillars. However, these parameters only become useful when preventive measures are put in place, such as hand washing, social distancing, general hygiene, and quarantine. And therefore, the only way we can succeed is when we have each and every one of us taking personal responsibility. I therefore would like to urge all our people to continue observing these simple but very effective containment measures. In the last 24 hours, we have tested 545 samples, out of which 15 persons have tested positive for coronavirus disease. This brings to the number 296 total number of confirmed cases in the country. 11 are Kenyans, while 4 are foreign nationals. And out of the 15 positive cases, 7 are from Mombasa, 6 from Nairobi, and 2 from Mandera County. None have any history of recent travel. With regard to gender, 7 are males, 8 are females. The 15 are aged between 19 to 75 years of age. 6 are from our quarantine centers, and 9 were picked up by our surveillance teams. And this is a clear indication that the infection is increasingly growing within our communities. And it is therefore very critical that we observe very strictly the measures that we've put in place with regard to containment. I am glad to inform you that 5 patients have recovered and discharged. We now have a total of 74 recoveries. A total of 2,851 contacts have been monitored, out of which 2,121 have been discharged. 730 contacts are being followed up at the moment, and a total of 14,417 samples have been tested so far.